Good evening. I'm Linda Pellerin, the Executive Director of the Shepherd Center of Charlotte, and this is Solutions for Seniors. The Shepherd Center of Charlotte is an organization, a nonprofit organization, that works with seniors to help them stay in their home environment for as long as possible. And we do this through various programs and services, and this is one of those services. We like to be able to bring you topics that are of relevance in today's age. And our guest this evening, I'm very excited about this, is Lynn Ivey, and she is with the Ivey, which is an adult daycare center. And Lynn, thanks so much for being on the show. I'm so glad you're here today.
Thank you, Lynn.
Can you tell me what exactly adult daycare is all about?
Great question. People always want to know, do they spend the night? And that's really the key. This is a place like home, maybe like a club, where older adults can spend the day socializing, making new friends, and also getting medical and health care supervision, having a good time, and they are safe throughout this day and can go home and stay at home at night.
Okay, now right away I'm thinking, for most adult daycare centers, what about transportation? Because usually if someone needs to go to an adult daycare facility, it's because there's no one at home for them, or maybe they may have children or relatives around, but they're all working or whatever. And so how do they, is it up to the families to get them there?
Yes, generally it is totally up to the families to make a decision on how they will get them there. There are options, and I would say that really varies per adult daycare center. Charlotte actually has 14 centers, and some of them have transportation needs and are having problems getting hooked in with the public transportation system. And other centers like the Ivey, we don't really have the need for public transportation. Most of the time, our families are able to provide the transportation. Now, interestingly, we do have some older adults who are not afraid of riding the bus or riding the special care transportation and enjoy coming all the way from Huntersville in some cases. We also have several companies who provide transportation services, and we connect the families with those services and let them make their own decision. There are some people who actually live in retirement communities who also will come to the Ivey and maybe other adult daycares as well. And in those cases, the transportation services from the retirement community will actually bring them.
Now, traditionally, what are some of the activities that are done during the day? Are there scheduled activities, like maybe like a senior community or?
Oh, absolutely, yes. We have a wide range of programs, and they are scheduled. We have a published calendar, and all adult daycares that are certified by the state have a published calendar of activities and events that go on each day. The programs include social programs. Part of them are health care, medical programs. Certainly nutrition is a big part of it. And I think one you could really feel like throughout all the programs, socialization and making friends and being connected to others is threaded throughout and the primary reason for being there. The secondary thing is we are connecting people through maybe psychosocial programs, reminiscence type therapy. We do exercise. We have recreational activities such as coin toss, cornhole, all of those types of bingo. Yes, they love bingo. And we even have the, bat the balloon around, anything that from a recreation standpoint that I guess gets the competitive juices going. The medical programs or healthcare programs are also very important and are what really make the adult daycare such a valuable service option for families, because most of the adult daycares have a registered nurse on site all day, and that person and the staff that is is employed there are skilled and trained to really look at challenges that occur in aging populations. We monitor blood pressure throughout the day. We monitor weight, and if there's a concern if someone is losing weight. We also administer medicines. So families will bring the medicines that their loved one is taking in the actual pharmaceutical bottle, and we keep them locked and make sure that those medicines are taken on a daily basis. And so many of them take so many meds that it's easy for those to be forgotten during the day. So the healthcare component is really important. Our personal care program, and many adult daycare centers also have this type of personal care where they can do bathing and have a hair and nail salon, podiatry services. We have someone who comes a couple of times a month to take care of those feet. They not really are set up to do fancy pedicures like we love to do, but these are actually wound nurses who are taking care of the podiatry. Nutrition is very, very important and is one of the first things that really kind of goes by the wayside if these adults are living at home alone. And we will accommodate special diets if there's a diabetic or gluten-free diet, salt-free, any of those kinds of diets are accommodated, and all of the nutrition programs or all the meals, I guess I should say, are actually approved by a registered dietitian. And many of these things I'm talking about are part of the state's requirements to be certified as an adult daycare center. Interestingly, along the lines of talking about people living alone, the majority of people who attend an adult daycare have challenges. They're living with Alzheimer's and other types of memory loss. And today, the National Alzheimer's Association released their 2012 report, Facts and Figures. And really, for one of the first times I've seen, they cited an alarming statistic about 1 in 7 adults, particularly those living with Alzheimer's, live alone. And that's over 800,000 individuals in this country. And if you can imagine the impacts that we're all hearing about dementia and the fact that they may be living alone, that's a very scary statistic, and how many things they're at risk for. And an adult daycare would be a perfect and wonderful solution for these people who are living alone.
What is the average age of someone who would take advantage of adult daycare in the Charlotte area?
I think that would vary among each center. For example, the Ivy's average age is probably 75, but there may be other centers who are taking younger adults who may have developmental disabilities. And at this time, the Ivy is not doing that, so it could vary. But I would say in general, it's the older adult, probably age 70 to 75. There's a new population that we need to be concerned about, and that is individuals who are diagnosed with younger onset Alzheimer's. And I know the viewers here are very familiar with so many that have come to light lately. Pat Summitt, the Tennessee women's basketball coach. These are people who are under the age of 64 who are working in the workplace, and all of a sudden things start going wrong. And we have seen quite a few of those recently. So actually, we have started a support group for folks in the Mecklenburg County area who are diagnosed with younger onset Alzheimer's. They have a unique situation where their spouse is not ready to retire, and all of a sudden, wow, and the individual themselves may be losing their job. So we need to be thinking about those types of people as well as our seniors.
We had a situation where, we use a lot of senior volunteers at our office and through our programs and services. And this was several years ago, but we had a gentleman who called to see if his wife could volunteer with us. And we were happy to have her, and he would go off to work. And it became very clear to us after a couple days of her coming, and she wouldn't come like every day or anything, but he was doing that because she really did need to have a sitter with her, or she needed to be somewhere where people could watch her. And so I unfortunately had to have a little talk with him and say, I'm sorry, but you know, there are other places. And you know, and like I said, this was several years ago, so there weren't a whole lot of the adult daycare centers open yet. And but you know, that's really what he needed. And of course, I recommended him having somebody maybe come to the house or something for her, just to keep an eye on her. And so, you know, that is very sad when things like that happen. You mentioned certification. I want to get back to that a little bit. Now, what is involved in getting certified to be an adult daycare center, and are some of the centers in Charlotte, are they offered through the government, or are they like privately owned also?
Well, first of all, with the state certification, there is a set of standards that are through the Division of Aging, Department of Health and Human Services, that are followed by each certified center. And in Mecklenburg County, really, I don't believe we have any that are trying to operate and not a certified center. There are many components to it. For example, it's an annual certification. A lot of people might say license certification. It's not a license, it's an actual certification, and it's certified on an annual basis with monthly monitoring by the local Department of Social Services. And the monitoring is built around several things. The facility has to meet certain requirements for square footage, the number of toilets per member or participant who attends, and many things that are related to managing a facility. Hot water temperatures have to be at a certain degree. We meet the county health department guidelines for water temperatures in all of the sinks. If there is a commercial kitchen on site, as there is at the Ivy, we have to meet the local guidelines for having, the health department guidelines for having a kitchen. Staffing is huge. As far as is huge for monitoring. We have to most definitely follow all really good, solid human resource guidelines with job descriptions, performance reviews. We have to have each person who has a direct care or a direct responsibility for someone in the center must be CPR certified and first aid certified, and those things are checked. We have background checks and drug tests, random drug tests done throughout the year, and the monitoring looks at that. The monitor looks at your invoicing and your financial information to make sure that you're keeping the proper records. We also have individual care plans for each member or participant who attends, and those are care plans that have goals in them that we need to achieve from a spiritual and a psychosocial and physical perspective, and those care plans are actually reviewed. Each month there is a different monitoring tool, if you will, or a different focus. And I could go on and on and on about that, but that is something that each center has to go through to get that certification.
Well, it's pretty extensive then.
It is.
Let's just say there's a family and they have a senior in the family that they would like to participate in an adult daycare anywhere in Mecklenburg County, really, but what do they need to be looking for when they go to a center?
Well, I think many of the things that you look for in an assisted living, a retirement community, any place that you want to place a loved one for the day or overnight, it all kind of rings true with adult daycare. You want to see activity. You want to see happy faces. You want to see people who are I guess, clean and well groomed, because they can be groomed there at the adult daycare, and you want it to smell good. I mean, that's just the bottom line, is you got to pass the smell test. And
it's funny you should say that, because I've been in not necessarily daycares, adult daycares, but I've been in some facilities where that's the first thing that hits you is the smell of the place. Yes,
it really is. And if it's going to be a place that's kind of home-like, or you're home away from home, or the club, or a lodge, or something to that effect, you want it to smell that way when you walk in the door. You also want to feel welcomed. You want to feel the love from the staff who are taking care of your loved one, and are they working, or are they talking with you one-on-one, or are they constantly looking somewhere else and worrying about something else going on? Mm-hmm. And really, are the people engaged? Because the adult daycare is not a babysitting service at all. And granted, people are going to want to take a little snooze here and there, but you don't want to walk in a place and see a whole sea of recliners and people taking a nap, and you want to hear the activity and hear the fun.
When you mentioned naps, I remember, if you remember as children, at least I'm dating myself, but sometimes you could lay your head on your desk at school or whatever, mm-hmm. and all of that. So is there like nap time, or is there?
Well, honestly, any time could be nap time.
Okay.
The state requires us to have at least one bed in a room where someone can go and take a nap if they want to. If I've seen someone use that room in the last 4 years more than twice, I would be surprised. What we find is, one of the other certification or pieces of the certification is how many comfy chairs you have. And so there are comfy chairs for people to take a little rest if they want to, and take their nap anytime. And that seems to be the best thing to do. We don't force people to participate in the activities, but we encourage them to join. And if they really are feeling like they don't necessarily want to be part of the group today, there are plenty of comfy chairs to sit in.
Yeah, well, this was kind of leads me to, there are some seniors that, especially when they live alone, sometimes have trouble interacting with other seniors. Mm-hmm. And if they have, sometimes they have a disease which makes them irritable, or whatever, or they have a malady which makes them irritable, and so how do you handle the cranky people that might show up on any given day?
Shower them with love. That happens. That absolutely does happen, and particularly in the cases that this may be a result of dementia, mm-hmm. or some type of memory loss, there are ways that our staff has been trained, and most staff is trained to take care of those situations and divert their attention, because what they're cranky about, what they're displaying their crankiness, might not be really what the problem is, mm-hmm. anyway. And so that one-on-one person, or you may find other attendees, we call them members in the center, who take on somebody and come up to them and want to take them by the hand and say, come on, join me over here and let's read a book together. And you see a lot of that kind of interaction going on. And then if there's really nothing that actually works, then they may need to just want to sit down, and we'll let them take a nap, or do what they want to do.
Have you had occasion where some of the people who attend adult daycare have become special friends?
Oh yes, oh my goodness, it is amazing. Particularly, we've got several situations at the Ivy, and I know that happens everywhere, that the friendships are just very strong, particularly if they are the ones who play cards, or the ones who enjoy certain activities together. One of the greatest joys, and there are many, we have a piano, and we have a gentleman who has dementia who plays the piano, and that's very, very normal in any situation, really. You bring out what was their greatest joys in the earlier part of their life. But we have him playing the piano, and a couple of women are standing on the piano, helping him along, and I'm thinking, all we need is a martini and a cigarette, and it would just be like Frank Sinatra.
Exactly. What do you think? Now, you know, we've got all these baby boomers. I'm a baby boomer, and you're probably a baby boomer.
I am.
I didn't want to throw that out there and offend you if you weren't. But so we have all the baby boomers, and I think the last number I read about, and baby boomers, for those who aren't aware, are anyone who was born between 1946 and 1964. I only can remember that because you just move the numbers back around. Yes, and. So I remember reading somewhere where it was like 78 million people are going to be aging into retirement. These are the baby boomers coming along. And, you know, what do you see for the future for adult daycare? Do you see it exploding, you know, with all the baby boomers and everything? Or, you know, what is your impression of what's going to be coming down the road in about 10 years?
I absolutely think adult daycare is about to explode and just really take off. Probably a lot in the way that childcare did a couple of decades ago. It's the most cost-effective service option for a family to utilize, and it's so cost effective that Medicare has looked at it, has studied it as a opportunity for reimbursement, particularly in the area of transition care upon discharge from a hospital. I believe in your previous guest was talking about Medicare reimbursing in the first 90 days from discharge from the hospital, and that very likely could be the case for adult daycare. With most adult daycares having registered nurses on site and having this health care component, and the way that health care is the next greatest industry, we're going to see quite a few. The adult daycares have grown 35% since 2002. Between 2002 and 2009, grew to 4,600 across the country. But to put that in perspective, the country of France has 11,000 adult daycare centers focused on Alzheimer's, and the United States has 4,600. So, as is usually the case, we'd have to catch up a little bit with Europe.
Right. Now, can people use long-term care insurance for adult daycare?
Absolutely. It is. I encourage everyone to read their policy because it does pay for. We have quite a few who use that. Generally in Mecklenburg County, about 12% of the population now is using long-term care insurance, but it does pay for adult daycare.
Okay, super. And do you, obviously I know the answer to this, but do you think Mecklenburg County has enough adult daycare centers at this time?
No.
Yeah.
We are doing a research project actually that is identifying pockets of Mecklenburg County that is still in need. In 2002, a study had been done across the country, down to the county level. At that time, Mecklenburg County had 10 adult daycares, and they needed at that time 8 more. And we're only up to 14, and the population has only grown. So we could use more.
Optimally, what do you think would be a good number for like right now, you know, to cover the county effectively?
Wow.
Ballpark figure.
Ballpark figure.
Not putting you on the spot at all.
I think we could probably use at least 3 or 4 more, depending on where they're located, because there are pockets that could use them more than others.
Okay, and so like in maybe 10 years, what do you think what we would need?
Wow. I don't know. I don't know how to describe
20,
that.
30 maybe?
Maybe not that many, but...
Because I'm thinking of those baby boomers.
Yeah,
you know?
well, that's true. That's true. We're already at 14, so yes.
And I think
20 to 30.
especially with the baby boomers, more so than even the seniors now, is that the families are fragmented with baby boomers, I know, I've got a daughter in Dallas, Texas. I've got another one that's local, but, my parents are in Vermont. I don't have a lot of family around me, and I think that happened with a lot of the baby boomers. We tended to move around the country,
That's
following
right.
jobs and things like that. And so, we can't count on family like in the old days where everybody kind of stayed put. So you can't count on family to be there for you for certain things. So, yeah, it's pretty interesting.
And the baby boomers want to live at home. They want to age in place.
Definitely.
In their own home.
Definitely, definitely. What do you think is, for you, what is the most satisfying part of your job?
Oh my goodness, to see that moment of joy when we've really connected with a person who is at the Ivy, and then to hear the family caregiver say that we have saved their life.
Mm-hmm. Now I know you're really connected into the whole senior community here in Charlotte and Mecklenburg County. I know you're associated now. You're on the board of the Council on Aging and
That's
everything. Right. What do you see down the road for seniors in this area, in the community?
Well, we've got a lot of room for improvement. I think we could really consolidate a lot of special organizations that are focused on the seniors and pool resources to really make an impact. We really would like to make this county senior friendly.
Yeah, and and I found, we work with a lot of the churches in the community, and many of them over the years have formed senior groups, and then the driving force of the senior groups, because they're run by seniors, maybe they fall away, they become ill, they pass away or whatever, and we're seeing some of those dying out, and the churches are just as strapped for money as everyone else, and so we're finding that many of the churches are now turning to us instead of having their own groups. They're like, you're already here, Shepherd
Right. Center's
here, and even you have the adult daycare center there. So, well, I'm very happy that you were able to come out here today and
appreciate
talk
you
with
asking
us.
me. This is great.
And I appreciate that, and I know you're doing a whole lot of good for the Charlotte-Mecklenburg community. And to wrap things up, we'll be back next month with a program on senior housing. So I look forward to seeing you next month. Thank you for joining us. Visit the Shepherd Center's website, www.shepherdscharlotte.org, or give us a call, 704-365-1995. Thanks for joining us. See you next month.